Hello and welcome. I am Kiran, my intern, and in this video, I will guide you through a step by step approach to history taking during ward rounds. History taking is a basic and essential skill for all healthcare students, whether you are in medicine, pharmacy, or nursing, because patient history forms the foundation of a good clinical practice. Studies have shown that around 80% of diagnosis can be made from a good history alone, even before physical examination or lab test. History taking is not just about asking questions. It's about observing, listening carefully, and building trust with the patient. So let's break it down step by step. The first step is observing the patient even before he approaches you. From the moment you see the patient, start observing. Notice their general appearance, posture, breathing, facial expressions, and any visible signs of discomfort. These first observations can give you valuable clues about their condition. Step 2. Introduce yourself and obtain consent. Introduce yourself politely and explain your role in the healthcare team. Always ask the patient permission before you begin. A respectful and calm approach helps make the patient more comfortable and encourages them to open up about their concerns. Step 3 is chief complaints. Ask the patient why they have come to the hospital or a clinic. Record the chief complaint in their own words without rephrasing or interpreting. This helps you understand what the patient feels is most important. Step 4 is taking the history of present illness regarding patient. Explore the current problem in detail. Ask when it started, how it has progressed, and whether there are any associated symptoms. Be systematic in your questioning and avoid leading questions that suggest an answer. Step 5. Take the past medical history and other relevant histories of the patient. Collect information about the patient's past illness, previous surgeries, drug allergies, and current medications. Ask about family history of illness and social habits such as smoking, alcohol use, diet, and occupation. These details often play a key role in understanding patient's health. Step 6 is a review of systems. I feel this is one of the most underrated part of history examination. Most of us omit this part, but this part even gives us much more information and will help us in performing a better differential diagnosis. So, do a quick review of other body systems to check for symptoms that may not have been mentioned earlier. Head to toe approach helps ensure that no important detail is missed. Step 7. Summarize and clarify. Summarize what the patient has told you and confirm that your understanding is correct. This step shows that you are listening and gives the patient a chance to add or correct details. The last step is closing the interaction. Thank the patient for their time and reassure them that the information they have shared will help guide their care. Always end the interaction in a polite and professional way. So, overall, patient history is not just a routine task, it's the foundation of safe and effective healthcare. So, in order to ace the patient history, we require observation, active listening, and clear communication. This comes only with consistent practice. So, by consistent practice, you will gain confidence and become skilled at taking accurate and meaningful histories. Let me take you through this clinical situation step by step so you can see how the history taking process unfolds during ward rounds. Let me give you one example on how this can be worked out. Let me use a single situation to explain all the steps of history taking. A 45-year-old male has come to the hospital complaining of severe abdominal pain, severe upper abdominal pain for the past 2 days. He says the pain started suddenly after dinner and has been constant since then. The pain feels like burning and sometimes radiates to his back. It worsens after eating fatty food and improves slightly when he sits upright. He has also experienced one episode of vomiting yesterday but denies fever or yellowing of eyes. His past medical history includes diabetes and high cholesterol, for which he takes metformin and atorvastatin. He does not have any previous surgery and is not allergic to any medications. His father has a heart attack at the age of 55. He drinks occasionally alcohol but does not smoke. On observation, the patient appears slightly anxious, sitting upright in bed and clutching his upper abdomen. His breathing seems normal, but occasionally he winces due to pain. In this case, a systemic history taking approach helped us gather crucial details about the patient's condition, medical background, and lifestyle factors. This information forms the foundation for developing a working diagnosis and planning appropriate investigations and management. Always remember, effective history taking is not just about asking questions, and moreover, the best diagnosis comes from the best approach of history taking. And as a pharmacist, we can suggest a best therapy based on best diagnosis. It's all about connecting the dots to provide the best possible care. With practice, this skill will not only help you gather important information but also build trust and rapport with your patients. Thank you.